So I hope, are you able to see my screen?
Yes, please, it is visible.
Great. So we could be wondering, the topic is very interesting, strengthening civic engagement for sustainable public health solutions in Busoga. But who is hosting this webinar? The answer is right here. Busoga Health Forum. Now you could ask yourself, but wait, what is Busoga Health Forum? Busoga Health Forum is an association of like-minded people and professionals stimulating community, government, and partner actions for better health of the people. We are a national, not-for-profit, voluntary, membership-based organization with our headquarters at the heart of Busoga, that is in Jinja City. As Busoga Health Forum, we work in collaboration with the Ministry of Health, local governments, and civil society organizations to coordinate health interventions through established technical working groups and technical or administrative structures, including the district health teams, formal and non-formal community structures. We work with everybody. Busoga Health Forum is therefore a think tank generating evidence to drive health policy action to improve the health and development of individuals in Busoga, but not Busoga alone, and even beyond. So what is our vision? This is what we want to see. We want to see a healthy, thriving Busoga. If we have a thriving population, the population is more likely even to be wealthy. What is our mission? Our mission is to rally Busoga professionals to use evidence to engage community, government, and partner action for better health of children, youth, women, and men in Busoga. What are our core values? Value addition. We want to add value. We believe in collaboration and integration. We are impact focused. We want to see the impact of what we do. We want results. Transparency and accountability. We are transparent and accountable to our members and the community. We invest wisely. Effectiveness and efficiency. These are our core values. You could ask, what programs do you have? What programs do you focus on? These are our core program areas. There are 5. Reproductive, maternal, newborn, child, and adolescent health. We also focus on malaria, HIV, and TB, of course, prevention, treatment, and everything about it. We also engage in regional planning and the use of data to solve the health challenges we have in our communities. We also focus on infectious and communicable diseases. And then finally, because we want our community to thrive, it's inseparable that organization will automatically come and become available. So we also focus on urban health. You would ask yourself, where can I find Busoga Health Forum? How can I reach out to you? How can I learn more about you? You can just go online on our website. The link is here. But you can also just go on Google and type Busoga Health Forum. You'll still be able to find our website. You can find us on Twitter at Busoga Health, on Facebook, Busoga Health Forum, YouTube. If you just type on YouTube Busoga Health Forum, you will find us. You can also send us an email on info@busogahealthforum.org. You could now be burning that, oh, I have learned about Busoga Health Forum. I want to become part of the initiative. I want to champion public health in Busoga. Please, you're welcome. Be part of the efforts to improve health in Busoga. How? By becoming a member of Busoga Health Forum. And it's very simple. You can just become a member by paying a subscription fee. You can come as 100,000 Ugandan shillings only. But you can annual subscription fee of 100,000 Ugandan shillings. But someone can say, me, I don't want to keep remembering every year that I have to pay. I want to pay once and a rest. Lifetime membership, you can pay 1 million Ugandan shillings. Thank you. Health Forum. So, next on our agenda, I have to introduce our speaker, our presenter, our facilitator for today, who is going to make us understand the topic of today. Let me first put down my slide. So our speaker for today is a Ugandan nurse midwife. As I introduce the speaker for today, if you have any question about Busoga Health Forum that you think I've not fully answered, you can type them in the chat. Others might be answered immediately, but others might be answered at the end of the session during the closing remark. So let's continue knowing more about our speaker. She is a nurse midwife currently pursuing a master's in sexual and reproductive health. She teaches at the International Institute of Health Sciences, Jinja, and runs a non-profit organization called Zoe Girls Health Initiative. The organization's strategic priority areas include the prevention of teenage pregnancy, the education and skilling of girls, and the rehabilitation of pregnant adolescents to become productive members of the community. She is an experienced adolescent sexual and reproductive health advocate with 19 years of experience in HIV prevention campaigns, for which she was awarded a Presidential Parliamentary HIV Prevention Award in 2010. Daphine has been involved in community transformation work for 21 years now, since she started when she was still young at 12 years, that is in 2003. She is a 2022 Mandela Washington Fellow, which is an academic and leadership training program in the United States of America. She's also a 2024 Alumnus in Residence Fellow at the Appalachian State University in North Carolina, and she's also an alumni of the Young African Leaders Initiative at the Regional Leadership Center, Nairobi, Kenya, and she was in cohort 60. These fellowships she has participated in laid a strong foundation for our expertise in civic engagement. And that is why Daphine is the best person to discuss the topic of today, strengthening civic engagement for sustainable public health solutions in Busoga. Let's welcome Daphine to speak to us. Nayebare Daphine, you are welcome.
Thank you so much, Humphrey, for that kind introduction. Good evening, ladies and gentlemen. It's a honor for me to be speaking with you all today. Thank you for logging in and taking your time to listen to me present. And I hope that we'll have meaningful discussions even after my presentation. Today, I'm going to be discussing something that I'm passionate about, civic engagement. And the topic is strengthening civic engagement for sustainable public health solutions. We all know that every community has its own problems, not just Busoga. So today we are focusing on Busoga because it's our region that we all love. And I know for each one of you on Busoga Health Forum, you're there because you are passionate about Busoga rising again. You're passionate about Busoga becoming a community that is healthy, a community that is prosperous, both from the family level to the regional level. Yes, so you are actually already playing your part in transforming our community. So, but Busoga still has many public health concerns, just like other parts in Uganda, other parts of Uganda. But I've highlighted just a few of them. Humphrey, please share the slides. Well, as Humphrey gets the slide up, some of the public health concerns in Busoga, some of them we've been discussing them here in different webinars, and many of us are aware of even the statistics. And I think we have many key players in all these different areas, especially in health, who have done a tremendous work to ensure that our communities are better places. But I'll list a few of them here. One of them is malaria, maternal and child mortality rates, which are high, teenage pregnancy. I think this has been sung so many times, both on this forum, but also even in our communities. And there are many of us who are involved in the work of preventing teenage pregnancy and ensuring that those adolescents who are already pregnant are given a second chance to life and dreaming again, and their babies are healthy. However, we still have teenagers that are still getting pregnant and dropping out of school, regardless of all these efforts that many of us have put in. Growing mental health issues. Just last week in my neighborhood, just a few kilometers from where I live here at Katende Road in Bugembe, last week, a border rider killed his wife and a 9-month-old baby, set the house on fire, and hung himself as well. But the fellow border riders say that they had already noticed that he was an aggressive person. He was very protective of his wife, but they never approached him because they thought, he's mature enough, he'll handle his problems. And by the time they realized that actually this was a big issue, he was gone, and his wife and innocent baby. So we can't deny the fact that we have mental health issues in our communities. HIV is another public health concern. There is a significant prevalence of HIV, of course, with these challenges in treatment, adherence, in adults, children, and adolescents in Busoga. Cancer of the cervix, we have high incidences of cancer of the cervix in our communities, sickle cell disease, and many others. Just I thought that these 7, to me, are the most outstanding. Yes, so these public health concerns, who is responsible? Whose job is it to solve these issues? Is it the government, politicians, local and international organizations, or NGOs? Is it the Ministry of Health? Who's supposed to solve these problems? If one said it's the government, they would be right, because the government has its part to play. Politicians, yes, we need to keep them accountable. We sent them to represent us. We voted for them to represent us in the parliament and in the different levels of leadership. So we need to hold them accountable. Yes, they should be able to play their part in solving these issues. The NGOs, non-profits, many of them have come up to handle some of these public health concerns. And yes, Ministry of Health has also played its part and is still playing its part. But after I move to the next slide, please. Humphrey. Next slide, please. So what I can say is that even though the government has a part to play, politicians have a part to play, local and international organizations, NGOs have a part to play, Ministry of Health has its part to play, and all these should be held accountable. But there's no single sector that can solve all our community problems. Every community has problems, like I said earlier. But there are problems in our communities that the government won't come to solve. Like if you don't have pit latrine in your community or in your home or homestead, and people are just disposing of human waste in the banana plantations, in the compound, the government may not come and build for you a pit latrine. If your children are sick, you might go to the government hospital for treatment. But after treatment, they'll still come back to your house. There's also some level of burden that will be on you as their parents. Ministry of Health and organizations, they can do their part. And all of us are here because we are doing our part. But in this presentation, I want to challenge us to how do we get the end consumers of our services, the people in the villages, the women, the men, the teenagers in the villages deep down who are end consumers of our services of kindness that we do to solve these issues. How are they contributing to solving their own issues? Is there ownership for the issues? And one time I know that at some point we may not be able to do what we've been doing or what we are doing. At some point we may be old, too old to run around and do what we've been doing, or we may shift careers. Then who else will play that part? And this is where civic engagement comes in. Many of us, you've had statements from our communities, things like government yetuyambe, the government should help us. Almost on everything, people are saying government yetuyambe. So what are those things that community members, the local residents of our communities can actually do to improve the quality of life of their communities? So civic engagement is active participation of local leaders and residents to improve their community and the lives of their community. The LC1 chairpersons, the VHTs, the mothers, the fathers, the men who wake up to sit in circles and play cards and drink Ajonol, what can they do to improve the quality of life of their communities? So when you talk about civic engagement, you're actually looking at the individual's willingness to solve local problems. And this is a spirit that is like most people in our communities don't have this spirit. Everyone is asking, I work with teen moms, and sometimes one of the most questions people ask me in the community is, how do you gain? Like, and then when you tell them, as long as girls in my community are going to school, children born to teen moms are healthy, and teen moms make better decisions and don't get repeat pregnancies. That's how I gain. I'm happy to make a positive contribution to my community. And they would be like, no, that's not possible. So those kind of beliefs that if you're not gaining anything in terms of money, then that is not there's no point in you helping. That's the spirit I'm talking about, that we need to break in our communities and challenge the members to wake up and participate. So what is the role? Community ownership. We want them to own their community, their problems rather, and we want them to understand how big their problems are, and then what part they can play, however small that part is. For us as Zoe Girls Health Initiative, one of the things we do is also through donors and supporters, we are able to take girls back to school. But our model is, if we are paying for a girl's school fees, the family has to raise requirements, has to raise books. If you are paying for a girl to study tailoring or hairdressing, it's the role of the family to raise money for materials, because we realized when we had just begun, when we gave them everything, parents like went hands off. Like, no, you know, there's an organization helping a girl, so they completely put their hands off. And so we realized that they feel like there is someone who's going to give us, so there's no need for us to put effort. And when we changed the strategy, we realized that some of the parents were able to play their part, because we got time and explained to them why it's important for this girl to go to school. And we explained to them why it's important for them also to contribute. Because on graduation, you don't want a teen mom to be praising Zoe Girls Health Initiative alone. We want to hear speeches where teen moms are saying, my parents gave me a second chance. And because my parents believed in me, I decided to make better choices for my life. I decided to pursue this. We don't want them to just say, I'm at school because Zoe Girls Health Initiative is paying for me. And slowly by slowly, we are seeing that parents are understanding the burden of teenage pregnancy. And as a result, they are able to find solutions for the other teenagers in their homes who are not yet pregnant. And they are playing their part. Of course, some are, and there are those who are not. But that's what we're talking about, the local people themselves playing their part, owning their problems and making a difference. So what does civic engagement look like? There are many forms of civic engagement. Many times when we talk about civic engagement, people think about politics alone. People think about democracy alone. Yes, politics is a form of is one form of an example of civic engagement, because it's a process by which the people reach a collective decision. People go to the polls and vote and choose the leaders that they want. And by doing that, they are already participating in their community affairs. And it's basically it's one of the examples of civic engagement. But there is also volunteering. Volunteering, serving your community. I think this, I don't know, maybe in our discussions, you let me know what is happening in your community. But in my community, very few people want to volunteer. People want to be helped, but they don't want to help. People want to be given, but they cannot give. People want to be favored, but they cannot favor others who are in need. And sometimes even the people who are given, they get entitled. You know, if the government is giving us portion, that's our taxes. So if the government is maybe building trenches and putting them in, repairing them, it's their role. And they repair a road or a trench, and within 3 months, it's broken down already. Come to places like slums around Bugembe, you see people pouring rubbish just in front of their houses, because there's a trench which is supposed to take water, but someone gets all the rubbish they've gathered for a week and pours in that trench. And if it doesn't rain, that rubbish will rot there. They're not even thinking about the diseases that could come from there. They're not even thinking about cleaning the trenches. They are waiting for the government. So how do we instill the spirit of volunteerism that even someone who sees rubbish in their trench will get out of their way to clean their trenches, not for the government's sake, but for the sake of their homes being healthy? Volunteerism. Recently, I'll share just briefly an experience of last year in October. I got an opportunity to be hosted by Appalachian State University for the Alumni and Residence Program. And while there, the Hurricane Helena hit, and many homes were brought down. People lost property, people lost lives, people's homes were buried, there was no water and power. It was a very sad situation. But for me, the biggest lesson I learned was the community's response. I saw everyone getting involved, volunteering their time, volunteering their energy, volunteering their fuel to drive to places where homes were buried and try to help. I saw people raising itself that hosted me, opening up their diner to serve meals. And the people who were serving, some of them were faculty members who volunteered to come to the diner every day to serve members from the meal. That's a spirit of volunteering. It's a job, but every community member was involved. And for me, that was a big lesson. And when I came back, I got more attached to my community. If there is any activity going on in my community, I ask myself, how can I be part of it? How can I help with the little that I have? So the other is advocacy. You can also view civic participation or engagement in terms of advocacy. You may not go and join the cleanup drives, but you may be a voice to the voiceless. In our communities in Busoga, we have girls who have been raped by their own relatives, who have been pregnanted by their own fathers, who have been sexually abused, and families have not come out to seek for their justice. And you might be in a community, in such a community, if you can get time to talk to these parents and show them why their girl needs justice, and show them that if this criminal who raped their girl, if he could get arrested and justice is served, he will serve as an example to others. So more girls will be protected. If I believe that if we took time to do that, then maybe some of these parents would understand and actually not cover up these cases. Advocacy comes in different forms. You could be speaking for the voiceless, you could be advocating for human rights, you could be challenging the status quo, raising funds for a cause you care about. There are many people on Busoga Health Forum here who fund causes, related to the public health concerns that I mentioned earlier. They don't have time to go in the community and get involved in this work because of the commitment, maybe to their job, or for one reason or another, but they give money towards those causes so that people who are able to go into the communities and solve them, they are able to do their job. So raising funds for the cause you care about is a form of civic engagement. Voting. How many people in your community I think right now we are 50 on this call, 50 of us. How many of our community, if you would estimate, how many of our community members actually registered to vote? Especially those who are 18 years and above. How many? Many make noise, but they're not even registered. They don't have national IDs. When it's time for voting, they sit back. Then they complain, this government is bad, but they don't vote. They don't participate in choosing leaders that would solve some of the challenges. Community organizing, organizing events, social events. I think last year, Busoga Health Forum, Youth Symposium, we had healthy camps, and many community members turned up. But how does it feel if someday we mobilize the community members themselves and tell them, you know what, these are the problems that you have, and we want you to be the ones to mobilize your friends, like each village, and mobilize your friends and bring them. How about if we empowered them, maybe to even health educate their own members, advocating for policy changes, educating masses, raising awareness about community issues. Do you know there are people in our communities who don't even know the problems in their communities? Like people just wake up, go to work and come back. Wake up, go to the garden and come back. They don't even know what is happening in their communities. But our communities have structures through which we can get information, like VHTs, LC1s. These are women counselors in our village. All those are structures through which we can create awareness about the health issues. How about if we think about dialogues in our communities? Because our communities are arranged in villages. What about if an LC1 decides and say, once a month, I'll call all the members in my village, or all the men, and talk to them about the advantage of educating girls. Or I'll mobilize all the mothers and teach them about their involvement in talking to their girls about sexual and reproductive health issues. The other way we can also participate is donating blood to save mothers. One of the causes of maternal death is PPH. And when the mothers when they need blood, most times the blood is not there. But when it's time to do donation drives, you see people walking by, they don't donate. And the same people don't know that if their relative or their wives are in need of blood someday, they will still be looking for that blood that someone else donated. So how about we let our communities know, like bring this information down to their context, in their language, involve the people that they see every day, like the VHTs, like their LC1s, to teach them about the importance of donating blood. I believe that we would have more, but many of them think, and also there's this belief that, why should I give blood, yet they are going to sell it. That also speaks to the people who sell the blood themselves. They are not helping in solving community problems. Humphrey, the next slide, please. So, change happens when ordinary people like me and you show up, speak up, and take action. Besides your professional job, your professional work, is there something that you're doing in your community? Let's start from your family. Let's go to your village, where you come from. Is there any difference? I usually challenge my nursing students and tell them that if you come from deep down in the village where there's no latrine, you come here and study nursing for 3 years, and you get a job in town, and then Christmas you go to your villages and still also go and use the banana plantations for toilet, then education has not changed you. If you still go back to the village and people sit in a circle during mealtime and pass the same katasa with water, and all the 15 people wash their hands in the same water, education has not changed you, nursing has not changed you. But if you went back to the village and bought a 3-liter jerry can and said, this is for washing hands, you've already participated in solving a problem. If you've built a toilet or health educated just your family and the neighbors about the importance of toilets, you've already contributed to changing your community. So how do we get our communities involved? Finally, we need to change them, or we need mindset change, trainings right from home. Let's teach our children about civic engagement. Let's teach our children that they can make a positive contribution in their communities, and they don't have to be paid to make a contribution that they can make. And if there is any payable contribution that they can make that actually changes the quality of life of their community, why not? Mindset change is very important in our communities. Again, I'm speaking to all of us as ambassadors to our communities, because I know the fact that you're on this call, you're already doing something in our community. But when you are tired, when you're gone, have you mentored someone else to take on? So today I was in town and I overheard a conversation. A fairly old gentleman was telling his friend, they had a conversation. He was like, if you have an office and you can't grow rich through that office, you'll never get rich. Having an office means that whoever has a document to sign, whoever needs any favor, has to pass through you and they have to pay money. So don't be in an office and sleep. You need to get rich. That would be okay if legally you're supposed to be paid to offer service. But if you're paid a salary and you still take advantage of people, extort money, and you're corrupt, you're not helping your community. So mind change should start right from our homes. Let's teach our children to be concerned. Let's teach our children, if you find littered papers and what in the compound, pick them up and dispose them off. If you eat something, don't throw papers anywhere. Take them to the right place. Let's keep our community clean. We need to hold regular meetings with community members to discuss public health concerns, again, at village level, so that they can get involved. We need to create volunteer opportunities. Like during the medical camp that we had, not everyone there was a medical personnel. Some of them were community members, and they participated and they were happy. And many of us received certificates that we even hung on our walls. Those are volunteer opportunities that we need to create for our communities. We need to organize village level health fairs like cleanups. If you use the same if your trench is filled with rubbish, maybe you can mobilize your neighbors and clean up. So if they see you, the Msawo or the professional, also putting on your gloves and getting your hands dirty to clean up the trench, they will be inspired. Then also we can make runs, we can organize dialogues and blood donation drives in our communities. I'm even envisioning like making it a competition. Maybe we say Bugembe, which part of Bugembe raised more blood? Is it Budumbuli? Is it Nakanyoni? Which part raised more blood? And then we give this feedback to the village members themselves. Then they see how much the little blood they've given can make a difference in the lives of mothers, We can also engage our LC1s. Our LC1s are not just supposed to sign papers and opening village meetings and close. They are also supposed to mobilize community, mobilize families, mobilize homes, even our VHTs. Let's also encourage community ownership of health initiatives. When you start an initiative in a community, help them own it, involve them in decision-making, listen to their opinions, let them see what part they can play, however small that part is, even if it's just registering that people attending the event, that is also a contribution. So that's how we can involve our communities. Benja, the slides have disappeared. So as the slides are coming back, I'm going to my very last slide. We can make a difference. We can make our communities a better place if each one of us identifies a role they can play and plays that role. If we can teach our children that volunteering is not bad, not everything has to be paid. Like not this norm of the world needs good people. Our communities need good people. And I know that even as people make statements like those, that whoever is doing something must be gaining something, I know there are still good people in our communities who have good hearts, who want to help without expectations. And those are the people we need to reach out and support to make our communities better. Thank you so much for listening. Over to you, Humphrey.
Yes, I'm Florian Paul.
Yeah, thank you so much, Daphine, for the wonderful presentation. I have been learning a lot of things, and I believe all of you have learned. So now we can welcome questions. I can see some comments in the chat, but if you have any question and you want to ask, you want to speak, please put up your hands and you'll be given the permission to speak. When you are talking about willingness to volunteer in the community, someone gave a testimony that in my community, even among the educated, all the challenges they have is because government has not done its role. All responsibility for the poor hygiene, poverty, among others, they take it to the government. Anything for their communities, they don't do. So these are some of the things our facilitator was talking about. Anyone with a question? Yes, someone is supporting concrete health education is needed right from the grassroots, but charismatic leadership is also needed. So I believe all of us are going to be agents of change in our communities. We are going to engage our communities. We are going to volunteer. We are going to support our communities. Anyone with a question before we go to the closing remark? I can only see appreciations here. Yes, we have one question here for you, our facilitator. How do we navigate around political intentions and affiliations? Whatever you do for the community in goodwill, people think you are planning to stand for a leadership office, which is not true at times. What advice can you give us regarding this, our facilitator? And then we can give Winnie a chance to also ask her hands is up. Over to you, Daphine.
Humphrey, I would suggest that everyone asks their questions. I'll note them down and then respond at once. Is that okay?
I think it's okay. Let's give Winnie a chance to ask her question. Winnie, you can unmute.
All right, thank you very much, Humphrey, and thank you very much, our dear speaker, Miss Daphine. A very good evening to you, team. For me, I don't have a question, but I just want to appreciate our speaker for really making the presentation very elaborative. And I just want to add on something that all of us are responsible for what is happening in our communities. So many times we look at problems and challenges, and maybe we think someone is going to follow from the heaven and they're going to come and help us to navigate those different complexities. But I want to say that all of us are responsible and all of us have power to influence and all of us have power to do something. It is about asking yourself, okay, what is it that I can be able to do? What is it that I can be able to use the resources that I have, the opportunities, the networks, anything that you have at your disposal, and you start from there. And it is very doable. You know, so many times you wait, maybe when I'm a leader, when I'm appointed, I'll go and do these big things and all of us. But you can start from your low level and then you can keep growing and we can see our communities become better. And yes, of course, we have challenges, you know, in politics, but, you know, there are some things that so many times we cannot control about. So choose what you can control, be a leader, influence, and do something really. Yeah, thank you very much, and back to you, moderator.
Thank you so much, Winnie, for the wonderful submission. Little Winnie is the foundation, the founder for the Little Winnie Foundation, one of the initiatives making impact in our communities. So these are some of the examples of initiatives we can create from whichever level. We have another question here. Okay, this one is a comment. Thank you so much, presenter, for igniting our spirits in terms of patriotism. I am very grateful. I wish I could listen to this every day. Yeah. This has delivered a fruit already, and I believe you are going to implement what you have learned. And then we have a question from Harriet Nangobi. What has been your experience with the political harm? We hope our presenter will give us our experience. Yeah, someone is saying, don't forget the CPD. That one, Benjamin will note it down. Others are only thank you messages. Great and educative talk. Thank you for the presentation. Thank you, Daphine. I'm very glad to hear this inspirational message. It's very interesting to learn that the session has been inspirational, and we believe it's going to create impact. All of you are going to implement, and you are going to cause the change we need. These are the only questions I can see as of now. I don't know if, yes, I can see a hand up.
Yes, that's my hand. I'm Benjamin Tatuma Desmond. I happen to be an OG to Daphine, a civic engagement class of Mandela, Washington. That's Yari. I want to really understand, Daphine, how do you advise young people in terms of balancing? Because you find that these are people who don't have enough income. Yes, they want to give back to their communities, they want to volunteer, but at the end of the day, they want to sustain their lives. And it is really that they need a balance. So sometimes they are mistaken, or sometimes they're not given the platform to exercise in the civic space because they don't have enough income to bargain. Over to you.
Thank you so much, Benjamin, for that question. Our facilitator will get back to them. Then Little Winnie has shared our contact. You can get in touch with her. You start connecting with important people who are making impact, and we make impact together. So over to you, Daphine.
Okay, thank you so much, Humphrey and Little Winnie Nabukeda, for I know that you're also one of those people that are giving back to your community. Thank you, and I know that you're also inspiring so many other young people. I've seen you doing your sessions even in nursing schools, and everyone who's doing something in their community, and everyone was appreciated. So there was this question of how do you navigate around political intentions and affiliations? When you do something good, members think you need, was it about leadership, which is not actually true. One, I must say that we don't control how people respond. We only control how we respond. And having said that, I will also add that when you're doing a community service, you should be clear about your intentions. And as long as in your heart you know what your intentions are, even when these negative statements come in, you'll not be demoralized by them or discouraged because you know your intentions. The satisfaction you get from seeing lives change in your community alone is enough. The other one I can say is that differentiate your personal views from political views. Maybe if you need to be careful on how you deliver your maybe service so that people don't think you're doing it because of politics. But even then, I know that there will still be people who will think that you're doing it because of politics. There's also a class of people who believe that you're doing things to be seen. There are people who believe, like in my community, there are people who think that I use thin moms to get money from whites. And so they will be like, that one takes pictures of tin moms and uses it and gets money. But then at the end of the day, if I listen to every negative comment, I will not move on. I will not do what I'm meant to do. Secondly, do some things that are within your means that you're comfortable about. Things that even your small contribution can make a difference. Otherwise, people will respond the way they want because they're entitled to their opinion. Yours is to just be clear about your intentions, know your intentions, and continue to give community service. I think because of time, I will stop there with that question. Someone asked me to share my experience with political, that question. Then also Benja was asking me, how do you encourage young people to balance giving back to their communities, and sometimes they don't have money. Civic engagement is, I think we need to not to confuse civic engagement and volunteering. It doesn't mean that whatever community activity you do, you're actually just doing it for free. But what I'm saying, if something that needs to change about your community is within your control, like I'm a midwife, I am a trained midwife. I know that in my community, there are pregnant women who are not attending antenatal. They are waiting to attend in second trimester. They're like, when you go, there's nothing they do there. Me talking to them about the importance of attending antenatal, I don't need to be paid for that. I can do that for free. I'm not incurring any expense. I'm not paying transport to explain that. They are within my neighborhood. I could go just and explain to them why it's important to attend antenatal or connect them to a health facility. I'm already making that difference in my community. So I think for young people, we just need them to know that they can even use their gifts, their talents. And I'm not saying that whatever they do for their community has to be totally free. We have people like Little Winnie who are doing coaching sessions, and people pay some little money to run the activities. But still, those people's lives are impacted and a difference is made. I don't know if I've answered your question, but anyone can do something within their means in their community, even when you don't have money. When I started this journey as a 12-year-old, I didn't even know about civic engagement. I didn't know anything. I just lost a friend to HIV. And because of my friend who died, I wanted to know more about HIV. I started writing to Young Talk, and they were answering me questions. And I asked my teacher, can I speak on assembly about HIV to my fellow pupils? And she said yes. And that was the start of my journey. And schools started calling me, and I would go, and many of them were not paying me. I would still go. I was happy to go. And look, many years later, 2010, I received an award, and I was nominated by someone who, an HM of one of the schools that I even had forgotten about. You get that point? So yes, that came as a benefit, but it wasn't my intention. I was a primary school child who didn't have money, but I had a voice, I had the knowledge I was getting from Young Talk, and I had a platform. Maybe finally, each one of us, now that we've listened to this presentation, we need to create platforms for these young people to volunteer, platforms for them to help, to contribute meaningfully. Let's not turn them down. Even our children, let's encourage them to volunteer whenever they can. Humphrey, I think I've answered all the questions. Is there one I left behind? Someone is asking. There's, I think, one more question. What has been your experience with the political arm? I don't really, Miss Harriet Nangovi, I didn't get this question clearly. Do you mean as the community service?
Thank you so much, Daphine. Actually, the responses you gave to a similar question that Dr. Pontian raised addressed what I really wanted to hear. Thank you.
Okay, great. Thank you. Over to you, Humphrey. Thank you all.
Thank you so much, Daphine, for ably addressing all the questions. For anyone having any more questions, I don't see any more questions, but just a small information before we call Benjamin for the closing remark.
Those are notifications. These are notifications.
Yes, if you would like to make a similar presentation on Busoga Health Forum, please, the phone number is here. You can inbox Benjamin on that phone number. But also, please register your attendance. There is an attendance form here. Please register. Someone is asking whether this presentation will be posted on YouTube. That one Benjamin will answer. Thank you so much, everyone, for taking time and learning from this session and your willingness to implement. I would like to take this time to welcome Benjamin to give the closing remark, and we end this.
Thank you so much, Humphrey. Thank you so much, Daphine, for this wonderful presentation. I will not have much. I'm going to play this short video. Just look at it. Then I'll talk about it. It is the line of the presentation we are having today. And I want to ask Professor Peter, when he's making his remarks, to thank Dr. Pontian. Dr. Pontian has been doing tremendous work this week. He has been in Uyende, and that's how it was the whole of this week. But he has been driving to Uyende to make sure that he trains midwives in that village on how to manage postpartum hemorrhage. We all understand how PPH is a monster to our mothers, but Dr. Pontian, who doesn't stay in Uyende, has given in this week to make sure. That's a video of how it was messy for him, but over because of a call that he has, and in the line of the sacrifice that seems like this presentation we have had, I want us to thank him as our hero this week. And at this time, let me invite Dr. Kaweru, who is the chairperson, CPDs, to give a word and invite Professor Peter to close this session. Over to Dr. Kaweru.
Thank you very much, the two presenters, for speaking to people about what they can do, what can you contribute in your own status towards national building or national service, because you are government. People always ask, who is the government? You are government, and you start by doing the little you can in your own area, and you move ahead and continue serving. So I want to take this opportunity to say thank you very much, and want to say that you should actually pick up the younger ladies and also get in touch with also other ladies who have been there in Busoga and other parts of the world, to make sure that actually we lift up the face of the younger girls in Busoga, because they are the mothers of today and tomorrow. And when you hold onto a young lady, you hold onto the entire world. They are the mothers of all of us. So, and we're also celebrating this month for mothers. You know that bleeding causes either bleeding during or after delivery actually claims life. And this week we lost a doctor, and it was very, very terrible. And we have lost so many other people. All people matter, and all lives matter. And that's why we are moving around to make sure that when the girl child is okay, the boys will be okay, the family, the community, and the entire nation and the entire world. So with those few words, I want to call upon Professor Peter Waiswa to make his comments. Thank you very much, Benja and the team and the presenters. God bless you for all, for God and my country. Over to you, Professor Waiswa. Professor, you are muted.
The moment he's joining.
Hello. Hello.
Yes, yes, Prof.
Yes, we can
Hello.
hear you, Professor.
Hello. Good evening, Benjamin. When you have big men like Dr. Kabuelo, you let them do all the job. So I'll just say something small to thank my friend Daphine. I didn't know that you're an activist also. I thought you just do service delivery care for teen moms and more. But now you came all the way from the massacres and you become an activist in the Bugembe and the Busoga and beyond, which is for me is a good thing anyway. So thank you so much. And I liked what you were saying that people need to be aware of what is going on in the communities. So as I've always said, one of my nurses I'm most proud of, the others. And I would like to believe that every nurse has the potential to do the same. If you can, so can they. With those few remarks, I want to hand it over back to Dr. Cavero to actually do the closure and award you a BHF certificate. Dr. Cavero, as our chair, over to you. Thank you.
But before to Professor you go, I want you to thank Dr. Pontian for the good work he has done this week in Uyende and for teaching people on PPH. In your words.
So Dr. Cavero also do that job of thanking Dr. Pontian.
Okay. Thank you very much, Professor. I want to take this opportunity to thank Dr. Ponshan, who has been mentoring and skilling and passing on knowledge to the midwives. You know, midwives, if they are not available, the maternal mortality rates increase. That is all over. So as much as they say the senior midwives who are the gynecologists, when they have the best midwives, they usually rest. So I want to take this opportunity. I know that we are celebrating this month for mothers, and it is very important that Dr. Ponciano took off his time. You see, if you look at the road going to BN, actually is not very fancy. There's a lot of dust, and I know if he trains, it can be very difficult also in terms of the train. So we want to take this opportunity and thank him. We can't thank him more, but I know God is very happy for the work he has done in this region, and may those midwives actually go along to save lives and also pass on the knowledge, so that as you get that stick, that button, also endeavor is to pass on the same button to the younger ones. So with those few words, I want to say thank you very much, Dr. Ponciano, and we wish you the best in your endeavors. And this evening also, I want to take this opportunity to thank Daphine Nayebare by giving you this certificate of appreciation from Busoga Youth Forum for your remarkable presentation on strengthening civic for sustainable public health solutions in Busoga at the Busoga Youth Forum this evening. It was quite wonderful. And we say that in case we come again, the Busoga says Chongero, you give us more of a talk and educate the masses. So thank you very much. And also I want to thank the moderator who was able to give us the background and the highlights, and also ushering in our dear presenter this evening. We want to thank Mr. Amufre Beja for moderating this session. It was quite interesting, and we want to thank you with this certificate of appreciation. We want to call members to attend this CMEs. There is always something you always learn. So with these few words, Benja, I want to thank you for the work you've been doing. And we shall meet on Sunday at 2 p.m. discuss other things. And I want to thank you very much, and the team, that may you have a good weekend, and God bless you all, for God and my country. Bye-bye. May God bless you all. Greetings to the families and the communities and everybody. Bye-bye.